and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Measles was declared eliminated in the U.S. back in 2000, but is now rearing its ugly head for the second year in a row. Last year, West Virginia saw its first case in 15 years, and as of March 6th, a total of 222 cases have been reported in 12 states, including West Virginia's neighbors, Pennsylvania and Kentucky. Measles is highly contagious and can result in serious illness and sometimes even death. So today, we're talking about everything you need to know about measles and how to prevent viruses like measles with Dr. Matthew Thomas, pediatric infectious diseases specialist and WVU Medicine Children's pediatric healthcare epidemiologist. Welcome, Dr. Thomas, to Live Healthy West Virginia.
Thank you.
It's great to have you.
It's a pleasure to be here.
It's good to have you here. It's good to have you here. So let's just basically start with what is measles and how serious can it be?
So measles is a respiratory virus that can be spread from person to person. And it can be quite serious. About 1 in 5 people that get measles can be hospitalized, and about 1 in 1,000 may die from measles.
Wow. That's not good to hear.
Not really.
Mm-hmm. Now, as of the day of this recording, there's been a total of 222 cases of measles in the U.S. over 12 states, including West Virginia's neighbors, Pennsylvania and Kentucky. And we have this recent incident at Dulles Airport in D.C. Should we be concerned about this coming to West Virginia?
It's a possibility. It could come here. The things that we have in our favor is that we actually have a relatively high vaccination rate in the state of West Virginia. Among our school-aged kids, last year, about 98% of them were immunized. So that does protect us somewhat. But like you mentioned, the Dulles Airport incident, especially for our Eastern Panhandle colleagues, they may be seeing measles coming out of that event, because that's a lot of people that were potentially exposed.
So it's something to be aware of.
Definitely.
All right. Now, measles was declared eliminated in 2000 in the U.S. So why is there more measles activity now?
So when they say that it's eliminated, what it means is we don't have a lot of spread from state to state to state. You will possibly see outbreaks among unimmunized or underimmunized communities if someone has traveled and come to one of those communities. So you may typically see small pockets of infection coming related to travelers, but we don't typically see a lot of spread. But as immunization rates are slowly creeping down, we may see more and more spread of it within the U.S.
So that's something to not look forward to.
Correct.
How do kids get measles?
So kids and adults can get measles from anyone that's had it. Typically in the U.S., it's related to travel.
Okay.
Somebody goes to a country that has what we call endemic spread of measles, where it's a known thing that's spread within another country and brings it back home. And somebody who's unimmunized or has an immune system that doesn't function as well as it should may be more at risk of getting measles. It's spread through respiratory droplets, so breathing in the same airspace as someone, and it can even be spread within 2 hours of being in that same airspace. Oh, wow. So you mentioned the Dulles Airport. As that person moved through the airport for 2 hours in any space that person was in, they could continue to get measles.
Oh, wow. That's a nightmare of contact tracing. I mean, where do you begin?
Right. I do not feel envious of the Virginia Department of Health right now.
No, not at all. So what are the symptoms of measles?
So you'll hear physicians talk about the 3 C's. Cough, which we all know. Coryza, which is a fancy word for having a lot of secretions in your upper airway. So a lot of runny nose, maybe draining from your eyes, and conjunctivitis, which is redness of your eyes.
Okay.
And then about 3 to 5 days in, usually around day 4, you'll get a rash that starts from head going to your feet. And it'll start from your chest and abdomen and working out to your arms and legs.
What's that rash look like?
So it's a very spotty rash. Some people will say it's kind of coppery colored, but most of the photos that you see will be kind of pink.
Yeah.
And it'll be very blotchy, and it will just cover you head to toe.
Yeah, yeah. Okay. So how is it treated then? What do you do?
There's no specific treatment for it. There is some data from other countries where vitamin A may help you from having severe disease, but there's no specific treatment at all. We do what we call supportive care. So if you're dehydrated, we make sure that you're hydrated. If you're having breathing issues, then we try to help you with oxygen or other breathing support if you need it. Some people get other infections on top of that, like a bacterial pneumonia. It can be a common problem with measles. And so some people will need antibiotics, but not all.
So you're treating symptoms?
You're treating symptoms.
Okay. And can this come with a real high fever?
It often has a very high fever for the first few days.
Like, what's your definition of a really high fever?
So about 104, even 105 for the first few days.
Yeah.
And those first few days of illness before the rash pops up, it can be hard to discriminate between measles or some other illness. So those first few days, you may not know that you have measles and may be spreading it.
So if you think your child has measles, what should you do? Do you wait for an appointment with your pediatrician? Should you go to urgent care or the emergency department?
If you're really worried about measles, call someone first.
Okay.
So unless you're really worried that there's an emergency situation, if you think you have measles, call your pediatrician and tell them that you're concerned. The risk is that you may spread it within your pediatrician's office or within the urgent care or with the emergency department. So if you're concerned, call someone first and they can help you navigate how to enter healthcare safely so we're not spreading it around the community. But if it's an emergency, show up to the emergency room, let them know right away that you're worried about measles, and then we can take care of that from there.
Is this something urgent care could handle as well, or is this strictly if it's that bad an emergency department
some people
situation?
Could be safe at an urgent care. But again, I would give them a heads up that you're worried about measles as soon as you arrive.
Okay, good to know. Now, measles can be serious in all age groups, but who's likely to suffer from, complications like pneumonia?
Yeah, it's our youngest kids. So the kids that are under kindergarten aged are the ones that are most likely to be hospitalized and have concerns. Those and our patients that have poor immune systems, so whether it's patients that are on chemotherapy or have some other underlying immune system problem, they may not be able to fight off the virus as well.
What about people that are over 65? Is the elderly population, because that seems to go hand in hand. What's dangerous for kids is dangerous for the elderly.
Right. So yes, in some of those groups, you may start, now some older people may have some immunity to that. Either they had natural measles because they're old enough when it was spreading across the US. But as we get older, some of us don't have the immune systems that we once did. So you may start to see issues amongst those as well.
Yeah, well, I know I had measles a long time ago, like in the 60s. So do I still have immunity, or should I get, a new MMR vaccine?
Most people probably still will have immunity even from having measles as a child or even having immunization some time ago. Truthfully, we don't test most people to see how their immunity is for measles this far out unless you're a healthcare worker.
Okay.
But if you're concerned about it, you could get lab testing. You probably don't need to.
Okay.
If you're somebody that was born after 1957 through the late 80s, we had a different type of vaccination for measles, so you might consider getting a booster. But for most people that have been immunized with 2 doses or who have had natural measles as a kid, you probably don't need to worry.
Okay, good to know. What if your infant hasn't had their first MMR, because you can't get your first one till what? It's like between 12 months and it is at a year.
Yeah.
Okay, that's right. Can your baby get the vaccine early? Like if you're really concerned, like you don't want to wait?
Yeah, the short answer is yes. For children who are 6 months and up, you can get an MMR vaccine earlier. Typically, that's for people who are traveling or who have been exposed. So we don't routinely recommend it. And I don't know if you've seen in the news, like particularly in Texas, they're having difficulty finding vaccine. Truthfully, I haven't heard if that's impacting West Virginia yet.
Oh, wow.
But supplies have been depleted in Texas particularly. So if you're concerned that you're traveling to an area where you might expose your child to measles, then that may be worth looking into. Otherwise, trying to protect your child from being around those with measles would probably be the best bet.
Yeah, because we're coming up on the spring and summer travel season.
Yes, we are.
All right. Well, good to keep in mind. So what is the best way to prevent measles?
So immunizations are best method for most people because you may not know that you're being exposed. Like we mentioned the Dulles Airport several times.
Yeah.
You don't know that you're going to be around somebody that may be sick in the airport. We kind of assume that there are sick people at the airport. You don't know the measles is going to be there.
Yeah.
So immunizing yourself, if you're of the right age and you don't have any issues with getting immunization, then is the most likely thing to protect you. It'll protect you about 95% of the time from getting measles infection.
And that's considered a very high rate, isn't it?
That is an excellent rate for an immunization. It's one of our best vaccines.
And it's not only the vaccine, it's MMR.
Correct.
Measles, I forget the second M.
Mumps.
Mumps and rubella.
Correct.
So it's a 3-for-1, right?
It's a 3-for-1.
Yeah.
Yeah.
Yeah, okay. So, and if you get your MMR at 1-year-old, you have to get a second vaccine, right?
Yes, you get 2
How
doses.
old? How old?
4 is when we usually do the second one.
Okay. All right. So we got to keep that up to date as well.
Correct.
All right. Can you still get measles even if you're up to date on your MMR vaccinations?
It's possible. So not everyone responds to the vaccine as well as others.
Okay.
And for most healthy people, we may not fully understand why some people respond and others don't. Some people will respond to a 3rd dose if you're one of those people that doesn't respond. But that's why it's only 95% effective.
Okay.
So there are some people that just don't respond to it as well as others.
Okay. But suppose my child gets measles. How do I protect myself, my children, and everybody else in the family from getting the measles?
So immunizing yourself before your child gets measles is the best. After that,
well, what if the cow's already left the
right,
barn?
If everything's already out, then the next best step is those who are unimmunized can come to care and get a measles vaccine within their first few days of being exposed. Some people can get what we call immunoglobulin, which is antibodies from blood donors that we can give to try to protect those who've been exposed and haven't made it in the window of time where we can get immunization. It is mostly a respiratory virus, so within your household, people who are in the house are going to be breathing it in. The other way it can be spread is through contact. So if you're not washing your hands appropriately, then you may spread it that way as well.
So hand washing, isolation.
Correct.
And if you do have a baby that's under 6 months and someone in your family, can you do like what's recommended for whooping cough? Since the child can't be vaccinated, you make sure everybody around them, the caregivers,
Correct.
the family, everybody else is vaccinated.
Yes, we try to immunize everyone around them to try to protect the baby. And a baby that's been exposed could also be a candidate for immunoglobulin as well, even if they can't be immunized themselves.
And I imagine babies, like we mentioned earlier, are more at risk for complications.
Correct.
And what about if you're pregnant and you get measles?
That is a big risk for the fetus. It's a high risk
Yeah.
of miscarriage for women who are pregnant and contract measles during their pregnancy.
So this can really get serious fast. So I always like to ask before we wrap up, what is the most important thing you want our viewers or listeners? What's the most important thing we need to know about measles?
Measles was eradicated in the United States by 2000 because of our immunization programs. So if you're wanting to protect yourself from measles, the best way is to get yourself immunized or check with your doctor if you're not sure if you are immunized against measles, and get yourself up to date. Otherwise, wash your hands.
Yeah. And I lied. I'm going to ask you one more question. What would you say, because I know there are people out there that are hesitant to get the MMR vaccine or the measles vaccine. What's your message to those parents that are hesitant?
Talk to your doctor about that. That is what we're here for. Your pediatricians are well versed in immunization literature and should be able to guide you through your concerns about immunization. Okay,
good to know. Well, thank you so much for sharing this information. I hope we've answered everybody's questions, because I think we're going to be talking about this for a while.
Yes,
maybe.
we are. Yes, we are.
All right. Buckle up. Thank you.
Thank you.
That brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about measles, visit cdc.gov/measles. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or on the all-new Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Thomas and everyone at WVU Medicine, thanks for joining us.